Hi guys, my name is Harpreet. I'm a registered nurse and a nursing coach in British Columbia, Canada, and welcome back to my channel. I always make videos about transitioning and helping out the internationally educated nurses from transitioning from their country's nursing into Canadian nursing. And if you haven't, please make sure that you subscribe to the channel because I post videos about all the process and steps and try to make it simple so that I'm able to help you guys. Alright, well, today we're going to talk about the competency assessment exam, which is NCAS exam in British Columbia Assessment Service, and this exam is particularly for the candidates in BC. Now this NCAS is actually a three-part competency assessment exam which involves some written part, some vivas, and also the practical or simulation lab assessments as well. And you can always compare it to the OSCE exams, which are applicable to some of the other provinces, but BC has particularly taken up this NCAS assessment. And you will be doing NCAS even if you are an internationally healthcare professional and you want to pursue your career as a healthcare aide or as an LPN, as an RN, or even as an RPN, which is the registered psych nurses, again a particular profession in BC only. And this assessment is also applicable to those candidates who have been out of practice for a while and who want to come back to practice, and this is another way to assess their gaps as well. Alright. Now, once you start your application process with NNAS and then your application comes to BCCNP, which is the new regulatory body, BCCNP is going to send you an email about referral to NCAS assessment, or this is a letter which says that now you will have to do this NCAS assessment as a part to test your eligibility to become an RN. And based on whichever profession you applied for, you will be sent referral for either LPN or RN, or the agency will ask you to take a dual assessment where you appear for both the groups. And let's talk about being a registered nurse first. So you will be appearing for this 3-core test, and there is no order, there is no particular order like you must take this test first or you take this second, but it is always a good idea to do your written exam before your simulation assessment. So you will be booking your dates for 2 days. The first test is computer-based assessment, which is your written exam. Now computer-based assessment involves 100 questions which you must be able to complete in a time period of 3 hours. And these questions are not any multiple choice questions. There will be very few of them, but majority of them are select all that apply type of questions, where you will be given 6 options and you have to choose 3 correct options out of them. And there will be scenarios. So every scenario will have 4 to 5 following questions, and then that's how they will divide about like 20 scenarios, 18 scenarios, and then you'll have a total of 100 questions. So this will be your day 1 of test, and to prepare for CBA, I would definitely urge you to get a review done. So you can either study by yourself or make sure like you get a class for review, and also practice as many questions as you can, because you can clear your fundamentals, but you also must know how to answer this particular like select all that apply pattern of questions. They are always tricky. You will be caught up in the last option, like okay, out of these 2, which one should I pick? So make sure like you do an intense review before you go for this exam. And then your day 2, which could be the next day, a week after, month after, whenever you get a date. But again, I would definitely urge that you get your dates as close as possible, because definitely you will be studying for your CBA, so that preparation is going to help you in your next exam as well. So the next day, or the day 2 of the exam, is definitely 2 tests. The first one is SLA, which is simulation lab assessment, and trust me, this is the one which carries a lot of weightage on your test. And SLA also involves OA, which is oral assessment. So in your SLA, there are 4 scenarios, and you will be given like different 4 stations. You can call them stations, and you will be spending 30 minutes on each station. But before 30 minutes, there is a 5-minute time period in which you can go over the chart or file of the patient and get to know what that patient, who that patient is, what kind of diagnosis, what kind of setting they're going in, etc. And take your time, take those 5 minutes, and then you enter inside the station, and there is an assessor who's always helping you, or assessing you rather, not helping you, and then you will be doing all your work as an RN. And as a registered nurse, we are really autonomous healthcare providers that we not only follow orders given to us by the doctors, but also we are autonomous to find out what activities are we going to do with our patient, what's happening. So you can kind of anticipate what's going on with the patient and how to deal with any unexpected events. After every station's SLA, you will be given time for OA. So in oral assessment, your assessor is going to ask you approximately 3 questions, and they will give you some time to answer those questions. Make sure like you keep talking and talk as much as you know. So for that, definitely your CBA review is going to help you. And yeah, so after every station, the same things are going to be repeated. Now, one important thing which I want to tell you is that 2 of your stations will have standardized actors, and who will be, or I would say standardized patients who are actors. And trust me, they're really, really good actors. You can't really tell they're patients or actors. Yeah. And the other 2 stations will be mannequins, and they could be high fidelity or medium fidelity mannequins. And I would also post the link to the videos which NCAS has on their website, which is really appreciative that they're just releasing more information about the entire test. So you can go over those videos because it actually tells you like how you can communicate with a mannequin thinking that they're not mannequins but actually patients, right? So make sure like you watch all the 3 videos which are on their website. I'll definitely post the link below. And once you're done with all these tests, then you will wait for your report. NCAS is going to send 1 copy of the report to you and another official report to BCCNP, your regulatory body. So that report actually tells you where did you lack, and it usually comes in like under 3 categories, whether you were consistent in doing the things, or you were in an emergent, mediocre kind of level, or you undemonstrated that task. So based on whatever your result is, that will decide your fate, whether you're going for a re-entry program, whether you're going for short courses, or if you were really not good, they may even ask you to go for a 4 years of BSN program, which is going to kill the career kind of, yeah. So NCAS is really a very important test, and I would definitely request everybody to thoroughly study before you appear for the exam, because NCAS is one-time opportunity. It's a lifetime opportunity. You cannot repeat this test. You have to give your best on that day. So make sure like you study well, watch all the videos, try to find out more about healthcare in Canada. And if you're not confident, I would definitely recommend going to some coach, taking some classes so that you know your concepts better, because as registered nurses, they expect you to know everything. Now here, definitely you will be performing your tasks as an entry-level nurse, but of course an RN at entry level is also somebody who is really intellectual and has all the skills, and definitely shows a very higher level of critical thinking. So yeah, this is all about NCAS, and I am sure you guys will have a bundle of questions on that. Please make sure you post your questions, you ask, because I want you to be prepared for this exam. As I said, it's a lifetime opportunity. So you can contact us through emails, or we are on Facebook, Instagram, even text us, call us, whatever way is feasible. And we would try our level best to answer your questions as much as we know. And yeah, make sure, don't forget to subscribe to the channel, and if you like this video, if it is helpful to you, don't forget to like it and share it with those people who actually need it. And I'll keep posting more work, and tell me what kind of videos and questions you have so that I can definitely release information on those things as well. And I'll see you guys in the next video. Till then, bye, take care, and all the very best.